The topic will consider anatomy of the nerve, the physiology, the nerve injury, mainly its classification, then dealing with nerve conduction and EMG in different clinical scenario, and then a bit about the nerve injuries and its regeneration, not the detail or technique, but just the basic concepts of it. And as I said, we want to keep it as clinically relevant as possible, but at the same time want to give you enough knowledge for your theory or practical exam for your MS, or if you're taking FRCS or in England. So the relevance will be in case you are in the dilemma that you're treating a closed fracture expectantly with a nerve injury, then when is the right time, if it is not recovering, to do nerve conduction study, which can be sometimes a bit confusing to people, and also in the exam, a very common question. Also, in nerve entrapment, where the diagnosis is not as clear-cut as this picture is showing, it's fantastic to see in the pictures that we can draw color diagram and say, okay, this is a carpal tunnel. But unfortunately, quite often in clinical scenario, it may not be that clear. And in that case, we may need a nerve conduction study. So we'll go through that. And in the end, we'll see whether this lecture has fulfilled that aim or goal. Just start with the anatomy. The nerve, as you all, consist of a mixed nerve. Will have a ventral and dorsal root with the cell body of the ventral root in the anterior horn cell, and for the dorsal root and the dorsal root ganglion. Together, they form a peripheral nerve connected with some autonomic nervous system, with the dorsal rami just supplying paraspinal muscles, and the main bulk is the ventral rami. This nerve, actually, the basic structure, as we all know, is consists of neuron, and which again consists of a cell body or soma, a axon, which is a long tube, and then its lower ends where it goes to either to a next synapses with another nerve or a neuromuscular junction. So that's the basic structure of any neuron. What you see in a peripheral nerve is actually neither the cell body nor the dendrite, because they are right at the end and they are very small portion of it. The whole big cables are actually the axons. So this is the slide for MS anatomy or FRCS orthopedics, which you can be asked to draw, and very important when you want to discuss what are the nerve injuries and what are type of this. So in the very beginning, I'll repeat this slide quite a few times in different format, so don't get bored with that. So the peripheral nerve, which we see, consists of bundles of axons. They are all clubbed together and then form a fascicle, and the number of fascicles are clubbed together and then form a peripheral nerve. When doing this, they are supported by connective tissue, and just remember there are three connective tissue. The very much inside, which is individually every axon is covered with, is called endoneuron. The fascicle is covered by another connective tissue called perineurium, and number of these fascicles then form together a bundle, which is the proper nerve, and then connected by epineurium. So if you just remember these three connective tissue, then you will know that what is a nerve. So remember endoneuron, perineurium, and epineurium. These are the three connective tissue which is holding an endoneuron, a fascicle, and the whole nerve all together. So this will be very important when we're discussing nerve injuries. So as I mentioned, the axon normally is myelinated. Sometimes you may have non-myelinated, and the myelin is deficient in between, which are called nodes of Renvir. And this is important when we are discussing later on how the nerve is transmitted. And connective tissue, as I already said, remember endoneuron, perineurium, epineurium. These are three connective tissue layer holding the nerves together. As I told you, I'll repeat it many times. So again, see this transverse section of diagram of a nerve. Very much inside is axons covered by red endoneuron. The number of endoneuron forming fascicle covered by perineurium, and then perineurium or fascicle held together by epineurium. Of course, nerve have its own blood vessels to supply blood, and those are called vasa nervosum, and bit of fat tissue, and that's the general anatomy of the nerve. And that's it for MS anatomy, for MS orthopedics, for FRCS. As far as anatomy of nerve is concerned, that's all you need. Remember endo, peri, and epineurium. and bundles and fascicles held together with these connective tissue. Let's now talk the physiology of nerve. We finished anatomy. The physiology, a typical neuron consists of dendrites, which are responsible for getting the incoming information. It consists of cell body, which is for integration of this information, and then axon, which transmit this information ongoing, and then axonal terminal, where the release of neurotransmitter happen. And if it is a muscle, neuromuscular junction, then muscle will contract after that. So that's a normal anatomy of neuron in terms of its physiology or function is concerned. Let's now discuss how these nerve conduction is done, or how the impulse is transmitted. Again, I would like you to remember three potential, which we will keep repeating many times. First is, a nerve normally have a resting potential, and we'll discuss this in a minute. Once you disturb a nerve in any forms, normally we talk about three main forms: chemically, electrically, or mechanically. It will disturb that resting potential, and what we call that disturbance is called changing that potential to a graded potential. Once that graded potential reaches a threshold, it will generate an action potential, and that action potential then goes down the axon till it reaches the neuromuscular junction. And we'll discuss that little bit more details in ionic form or chemical form, so that in exam you know what is happening, and this will help you with your understanding of nerve conduction study later on. So what is the resting potential? If you put an electrode inside a nerve and outside, there is a difference, and that is what is the action potential. So normally we say it's a minus 70 millivolt. It is minus inside and positive outside. You will wonder, why should we keep this imbalance? Normally we should always live in peace. Chemically and electrically, the potential should not be any difference, but there's a purpose for this, and we will know that when we understand the nerve conduction study, that why body try to keep this resting potential and what happens when it is disturbed. Okay, to start with, let's first understand how the action potential works and how resting potential works. At this moment, if you just remember, sodium chloride or salt is normally more abundant outside the cell, and potassium and anions, which are normally protein anions, are inside the cell. So the potassium and anion, which are inside the cell, and sodium chloride outside the cell, they are all kept in different concentration inside and outside, so that the resting potential of minus 70 millivolt is maintained. And this difference is created by a special mechanism of gates. There are a number of gates on the cell, which can open or close depending on whether you get a stimulus or not. But for the time being, for you to just remember, salty water inside and potassium and protein, salty water outside and potassium and anion are inside the cell, and we'll discuss that in a bit more details. Let's now see an anatomy into more details, what is happening at the ionic level in the cells. So as I told, cell membrane have gates, which normally remain closed, and they maintain this gradients of inside potassium and protein and anion, and outside sodium chloride. Because of this maintenance of gate, a lot of energy is required. As I said, normally you would expect that everything is in balance, but to keep minus inside and positive outside, we have a special sodium potassium ATPase pump. This keeps this balance, and this will be important when we see how the conduction is transmitted. So whenever a stimulus comes, as I said, the stimulus can be chemical, it can be electric or voltage, or it can be mechanical. It somehow can open those gates. Just remember the gates on the membrane. And when the gates are open, these ions can flow one way or other way, depending where the concentration is. And we'll talk that in a minute. So when the concentration inside is, the electric activity inside is minus 70, that is called a resting potential. And let's say when the electric activity comes, gradually these gates open. And when these gates open, there is a generation of what we call this one, graded potential. If this graded potential keep on building and it reaches a threshold, which is normally considered minus 55 millivolt, immediately the action